The first batch of 80,000 Johnson & Johnson vaccine doses arrived in the country last night. 500,000 more doses are set to arrive in the coming weeks. That will culminate with the arrival of 20 million doses of the Pfizer vaccine before the end of next month. Currently, the government estimates that the vaccines will cost between 2.5 billion rand to vaccinate 10% of the population, 9 billion rand to vaccinate 30% of the population, 15.5 billion rand to cover half the population, 21 billion for 2/3 of the population, and a massive 30 billion rand to cover the whole population.
We have had lots of discussion with the Minister of Finance, basically to say that the fiscus is going to carry the major burden of having to procure the vaccines. In the process, we've also agreed that we will look at and activate other means of raising additional funds, and that is the second way would be to approach the medical schemes and ask them to make a contribution, which will also be on the basis of social solidarity, wherein they could also cross-subsidize some of the members of the public. And the third one is to get donors, business to also make their own contributions. And so these together could be work together with the Solidarity Fund. So quite a lot of mechanics of making this system to move on are in place.
Details of exactly where the money will come from will be announced by Finance Minister Tito Mboweni when he tables this year's budget in Parliament next week. Mbongeni Mucho, SABC News, Johannesburg.